COVID-19 cases are surging across China.
The situation is so bad that panic
spreading across China.
That's right. COVID-19 is making headlines across the world once again. And this is because China has been witnessing a sharp rise in coronavirus cases. Agencies like AFP and Reuters report that China's hospitals are struggling. Its pharmacies have been emptied of medicines and its crematoriums are overwhelmed. So what is causing this surge in COVID-19 cases in China? Is it a new variant or something more? Let me explain. First, the numbers. Just how many COVID-19 cases is China reporting? Officially, China recorded only over 3,100 new symptomatic cases on December 20th. A day earlier, China reported over 2,700 fresh cases. But many reports suggest that these numbers are just a fraction of China's COVID-19 caseload. In fact, just weeks earlier, COVID-19 cases in China had climbed to nearly 40,000 cases on November 26th. Reports say that China, that had once tracked every COVID-19 case, including asymptomatic and mild infections, is now not giving clear data on the outbreak. As far as fatalities go, China reported no COVID-19 deaths on December 20th. A day earlier, China reported 5 deaths due to COVID-19. And on Sunday, December 18th, China officially reported 2 fatalities. These fatalities were China's first in 2 weeks. Now, the official numbers may not give a true picture of what's really happening in China. But remember, this is China, where data and information is especially opaque, making it really difficult for international observers to gauge just how bad the situation really is. On social media, meanwhile, these images are going viral of hospitals being overwhelmed with patients, of dead bodies lying unattended in hospital corridors, and of hearses queuing up at crematoriums. These images and visuals have not been verified. Now, although China's official data may not capture the true extent of its current outbreak, many experts say that what's happening is just the beginning of its wave of infections. The chief epidemiologist of the Chinese Center for Disease Control and Prevention said that the current outbreak would peak this winter and would run in 3 waves for around 3 months. So why is China seeing a surge in COVID-19 cases? There are primarily 4 reasons. 1. The easing of China's zero COVID policy has led to this current outbreak. For 3 years, China, under the leadership of Xi Jinping, followed a strict zero COVID policy, attempting to contain the spread of COVID-19 with extremely harsh and restrictive measures. China continued to adopt this zero COVID strategy even as the rest of the world moved on from strict lockdowns and learned to coexist with the virus. Then on December 7th, China dismantled its zero COVID policy after protests, scrapping mandatory hospitalizations, mass quarantines, doing away with stringent lockdowns, and easing up on travel restrictions and testing requirements. China's COVID-19 caseload went from nearly 40,000 daily cases at the end of November to around 2,000 to 3,000 daily cases this week. But this decrease in its COVID-19 caseload may have to do with its drop in its testing. Now, the surge in COVID-19 cases was expected. After all, Hong Kong and New Zealand, which also followed the zero COVID policy, witnessed similar outbreaks after they moved away from the strategy. This brings me to factor number 2, low herd immunity. Because China has been shielding its population for the last 3 years, herd immunity is low, meaning that much of its population has not been exposed to the natural infection and are therefore not immune to the virus. What's more, vaccination rates are low, especially among vulnerable groups. This is reason number 3. Officially, China says that its vaccination rate is 90%. But the problem is that only around 66% of people above the age of 80 have been fully vaccinated. This percentage drops further when it comes to booster doses. While less than 58% of adults have received their 3rd shot, only 42% of people above the age of 80 have received their booster dose. There is one more factor contributing to the spread of COVID-19 in China, and that's the lower efficacy of China's vaccines, namely Sinovac and Sinopharm, which is why the focus now is on giving booster doses to the elderly and high-risk groups. China recently said that it was rolling out a second booster dose to people above the age of 60. Experts say China's rise in COVID-19 cases has been driven by the sub-lineages of the Omicron variant. These sub-variants have been found in the rest of the world as well. Nonetheless, what's happening in China is a cause for concern for the rest of the world. Experts have pointed out that with COVID-19 cases spreading in China, there is a possibility of the virus mutating further and resulting in newer variants. Which is why, in light of the rising COVID-19 cases in China, as well as in countries like the US, Japan, South Korea and Brazil, India's health ministry wrote to all states to increase genome sequencing to detect if there are new variants circulating in the country. Incidentally, India reported 131 new cases and 2 fatalities on December 21st. So although you need not press the panic button yet, what's happening in China is a reminder for all of us that COVID-19 hasn't gone away. So mask up and stay safe. Before I go, I just want to quickly remind you that if you value the journalism that we've been doing here at the News Minute, do support us by becoming a member. Also subscribe to our YouTube channel. And as always, if you like this video, hit the like button and share this video with your friends.